So today, though, we're here to give you a little bit of information about Cleveland Dental Institute and what we do, but then also kind of give you some tie-ins to dentistry for overall health. So this is actually something I love to do. So I've been in dental for a long time, probably 20-some years, in different aspects of dentistry. So we've put together some, I think, some meaningful information for you. So Cleveland Dental Institute, we are actually going to be 2 doors down here as soon as we get it built. We're really looking forward to that. Should be somewhere, our permanent site, somewhere around May, possibly a little bit earlier. Right now we're over at ACMC, where the primary care doctors used to be. So we're sharing space with the orthopedics department. So if you go in the front doors, you turn immediately to your right, that's where we are. We have 9 chairs over there right now. We've started out with 4, we expanded, we just expanded again. We have multiple doctors over there. So we're seeing lots of patients and just trying to keep up with the demand here. So we were very thankful about that. So Cleveland Dental Institute, kind of what are we, what do we do? There's been a lot of I think, some misinformation in the community about what we are, probably more so because of our name. But we have 3 locations right now. Ashtabula is going to be our 3rd. We also have 2 in the Cleveland area. One is in the Lee Harbor neighborhood, and the other one is in Shaker Square area. So Shaker Square location was our very first location. We did a big expansion on Lee Harbor, so we have like 14 chairs over there. Huge training room. We do lots of training and education events. And that is how our location here will be as well. We're going to actually have 16 chairs here. So again, trying to accommodate the need. So our mission as a group is basically to bring dentistry to an underserved market. And so most of the locations that we've been at are in areas where we feel like there's more people that are underserved. And when I say underserved, what I mean is, and I'll get into this a little bit, is that not everybody has access to dental care for a number of reasons. One of those reasons can be cost, and others can be just the lack of providers. What we found in Ashtabula was there weren't really that many providers, and when we looked at certain categories of people, like kids, for example, there were really no pediatric dentists in the area, like within 45 minutes of Ashtabula. So we saw that there was a need here, and that was one of the reasons that we chose Ashtabula. And so far, it's been incredible.
I would imagine that a lot of you have children, grandchildren, nieces, nephews who have gone probably one of 2 directions, right? So either Menor or Erie. And our whole goal is to bring dentistry here to Ashtabula, make it a little bit easier on everybody so that parents don't have to take a half day off work to send their kid to the dentist or to take themselves to the dentist. So it has been a really, really good experience here in Ashtabula so far.
So one of our other goals with this is we want to become active in the communities that we're in. So the way that we are able to know how we can help is really to be part of the community and understand the community, and therefore we can then understand where the needs are. So Sean and I, probably starting back in May of last year, started coming out to Ashtabula and trying to get to know people. We met with government people, we met with business people, we met with community organizations, and basically tried to find our way around to get involved as much as we could with this community. And I think we found that it's really worked. One of the things that makes Cleveland Dental Institute unique is kind of our structure. So what I want to make clear, because people kind of get a different connotation when they hear institute, we are not an undergraduate teaching institute. We are a for-profit dental practice. So just like any other dental practice, we are a dental practice, What's different about us is that we run 2 postgraduate residency programs out of our practice. So we have what is called an AEGD program, which is a 2-year program, and a GPR program, which is a 1-year program. Best way to describe that is if you think of it in terms of medical, medical doctors go through a residency. We all expect that. We know that they do that. That's exactly what's happening here with us. So our doctors, I think the most important thing for you to know is that our doctors are fully, they've graduated, they're fully licensed doctors. But they're doctors that have decided to go on for 1 or 2-year specialty training. So if they had decided not to do that, they could hang up their shingle and open up their own office, or they'd be working for somebody else. Our guys have just decided that they want to go on for some specialty training. So we have this group, 2 different groups of doctors. That gives us a lot more providers, and it's one of the reasons why we can have practices that are so big and we can accommodate so many people. It's also one of the reasons that we can keep our pricing structure much lower than an average dental practice. It's because we have these providers in our residence, which is great because it fits our mission. We want to bring dentistry to people that don't have dentistry available to them. Cost is a big factor in that. So we're able to keep our prices low, but offer the same kind of procedures. And if you look at the number of procedures that we have, basically we do everything. One of the other advantages that we have, I believe, is that because we have these residency programs, it is very important for us to keep up with the latest and best technology. And there's been a lot of technology, I'd say, in the last 5 years that has been added into the dental market. And we have everything, which is very unusual to see. And the reason for that is because of the cost. For us, it's important because we are basically helping to train the next generation of dentists. So our feeling about it is that in order for them to be trained well, they need to be utilizing the most recent technology. And that is a real benefit for our patients. So, for example, we've talked about this a lot on the radio. One of the things that's happening in dentistry right now is what we call digital dentistry. For those of you that have ever had an impression taken, anybody ever had an impression taken in a dental office? So you know they fill the goop into the trays, and they put the trays in your mouth, and hopefully you don't gag and you make it through it. Well, with the technology that we have today with digital dentistry, in our practices we have a wand that literally we call it a wand. It's about this size. And all we have to do is just wave that across your upper and lower jaws, and it takes a picture of your mouth, which is created then on a computer screen. So we can see it building as we're waving the wand across. Now what's nice about that is you don't have any impression trays and you don't have any goop and you're not choking. But the other part of it is you never have to redo an impression if you've ever had that done, because the impressions don't always come out perfectly. So when we're looking at it on the screen, we can see if there's a void in it. We just take the wand and put it right over that area, and it just fills it in. That image is now sent to a mill. We put a block of ceramic material into this mill, and it now just makes your crown for you. And it'll zip it out in about 45 minutes. So the days of having to do the goop and leave the office and go away for 3 weeks or a month and come back and get your crown and hopefully it fits are gone. It's all taken away with this type of technology. We have that available to our patients. So it's those kind of things, I think, that are a real benefit for the patients that come to see us.
And it's definitely something that we've put an emphasis on, because in dental school you don't necessarily get access to all of this technology. So the best way to describe it is they learn a little bit about a lot in dental school. So they come to us and we try and broaden expand on everything that they've learned. And with the technology we're able to do that, especially because they don't, dental schools in some cases are 5, 10 years behind in technology.
And the reason for that is because of the cost. Like the dental schools really can't keep up with the technology. Technology is changing rapidly, that's one reason, but it's also a cost factor. And like Sean said, most undergraduate dental students, so if anybody's gone to CASE, for example, if you go to the CASE dental clinic, you are being seen by undergraduate dental students. So those are students that have not graduated yet, they don't have a license. That is very unlike the situation that we have. Our guys are all postgraduate and they have their licenses, they're full-fledged doctors. So the other components of this, I said, is cost, and we all know that. So dentistry is costly, as is anything medical. We basically accept everything, and this is another way that we're very different. We accept everything from Medicaid all the way through self-pay patients. So that means we have Medicaid, we actually accept every bit of Medicaid, all of them that are out there. Also private insurance plans, and we also have some people that are self-pay. They don't have any kind of insurance plan at all. What we did, kind of to the point of our mission, is to bring dentistry to everybody, is we implemented a program that we call CODE. And I think the next slide is going to talk about CODE. So the idea with CODE was that there's a pretty significant population of people these days that don't have dental insurance. One of the things that companies have done in recent years in order to save money is they've cut out dental plans, vision plans. In a lot of cases, they've cut down on the medical plans that they're offering, or they're making the employee pay a bigger and bigger percentage of that care. So what we did, knowing this, is that we developed this program that we call CODE. CODE, kind of what I've been talking about, what it stands for, the acronym stands for Community Outreach for Dental Excellence. So the idea was, again, reach out to the community. We want to be part of the community. This whole plan, the summary of it is that we wanted to bring dentistry, affordable dentistry, to people that had no coverage. So in essence, what this is we wanted something that acted like and looked like an insurance plan, but that you didn't have to pay a premium for. Because when I looked at it, one of the things I know as a barrier to taking part is the cost. So I didn't want to have to charge people a monthly fee in order to have this program. So in essence, what it is it's a discount program. And what we did is, again, because we're lucky enough to have these residents, I looked at what our Medicaid reimbursements were, and then I look at what the cost of dentistry is if you are a self-pay patient. And what I did is I took these costs down to meet these reimbursements. So the CODE plan represents about a 40% discount off of standard fees. So even if you were in a private dental insurance plan, our fees for all of our procedures are basically 40% lower. So again, the idea being, okay, let's make it affordable for people to be able to come see the dentist and at least get their teeth cleaned, a couple of times a year. Don't let cost prevent them. So biggest thing there is no cost to you. Basically, the CODE program is available to, originally we meant it for companies that wanted to offer something to their patients, but the more we got into it and started talking to people, we expanded it. So it's really available to companies, organizations, and individuals. So if people come into our practice and they say they don't have dental insurance, we'll try to put them in the CODE plan. You get a card, just like an insurance card, has your own number on it. You actually do have code. And that tells our people that you get this special pricing. So there's no cost to you for that. So a couple of things about just overall health. One of the things you may have heard in your lives is periodontal disease. Anybody hear periodontal disease? Okay. So periodontal disease, if you look at really what it is, it basically is kind of a destruction of the hard and soft tissues surrounding the teeth. So what ends up happening is when you have periodontal disease, the soft tissue that's kind of holding your crown in place and the hard tissue that your teeth are actually anchored in start melting away. That's the best way of describing it. The reason for that is usually because people that are prone to periodontal disease have a larger percentage of plaque buildup that accumulates on their teeth. So they need to remove it much more frequently and much deeper than somebody that does not have periodontal disease. So if that makes any sense to you. One of the things we talk about is gingivitis. Gingivitis is basically the first step in periodontal disease. So if you go to the dentist and he says, ooh, you have gingivitis. Gingivitis appears usually as inflamed tissue. So your tissues kind of look swollen. They may be more red. If you see blood in the water when you're brushing your teeth, that is a sign of periodontal disease and gingivitis. That would be a reason that you would definitely want to get yourself in to see a dentist. It basically is destroying the supporting tissues around the teeth. So eventually, if it goes unchecked, your teeth will become mobile.
And I think one thing is that it's important to know, just like with anything in dentistry, sometimes you can't control it. So don't get discouraged. We see people who come in all the time with cavities, and oftentimes you can just kind of chalk it up to genetics. Some people are more prone to it than others. So gingivitis, you can do what you can to prevent it, but sometimes it's going to come for you anyways.
Yeah, there's definitely a genetic component to it, and there's actually a test that a dentist can give you that measures what they call interleukin. It's a gene, and if you have a certain measurement above a certain level, it means that you're genetically prone to periodontal disease. So it's a nice test to have so that you would know, okay, I'm prone to it, so that means you need to kind of go to a lot of extra steps in order to kind of prevent it from progressing. So in terms of treating periodontal disease, when you go to the dentist, what's recommended for most people is 2 cleanings a year, every 6 months. Somebody with periodontal disease, we recommend 4 times a year. And usually what they do is they will rotate their cleanings between their general dentist, which is the doctor that you see whenever you go to the doctor, usually, and a periodontist. When you have periodontal disease, there's actually a specialist called a periodontist that you can go see. And they're usually the ones that they're specialized in periodontal disease. So you would do 2 cleanings at your general dentist, and you do 2 cleanings at your periodontist. Sometimes general practitioners can keep that all in-house. Like for us, we have periodontists that come into our practice, so we can keep the patients just in the same practice, and they can do their 4 cleanings in the same place with the same doctors. One of the things that you'll hear about with periodontal disease, some of you may have heard this term, deep root scaling and planing. Basically what that is a subgingival cleaning. So when they're cleaning your teeth, usually they're kind of cleaning the crown part of it, and they're polishing the crown part of it for you. When you have periodontal disease, calculus and plaque build up underneath the tissue, and so they have to get underneath the tissue to scrape off all that calculus and get it off of there, because that is what's going to make the disease progress. So it's really important that that be done, because if you don't, eventually this is what ends up happening. So what happens is...
Sorry if we have any weak stomachs.
Yeah. I mean, it's good to know, because what happens with periodontal disease is that you start losing the tissue and the bone. So your teeth, the roots of your teeth are anchored in your jawbone. What happens is the bone will start going away. So you can tell here that this is where the bone levels were. And so when this progresses, you just start losing all that bone, and now your roots actually become exposed.
Is that stitches?
It's painful. It definitely is painful.
The idea is to scare you into brushing your teeth every day.
But you don't want it to get to
Scary
this point.
No.
So you know, there's surgical things that they can do. There's all kinds of different things that we can do to type so that you don't get to this point. One of the things that we mention is brushing twice a day. If you're somebody that has periodontal disease, the doctor will generally put you on a special mouthwash. It's called Peridex. The brand name is called Peridex. Tastes awful, but it prevents the disease from progressing. They can do surgical interventions. There are medications that are on like floss type things that are tetracycline that will also help prevent this from happening. So there's any number of things that you can do to prevent it, but getting to a dentist and getting it diagnosed first, you have to do that first, obviously. So what are the signs? Bleeding gums. If your teeth are becoming mobile, that is a definite sign that there's periodontal disease there. Bad breath will also key sign. One of the things we wanted to mention in terms of don'ts, and this would be don'ts for anything, not just periodontal disease, but obviously smoking, everyone knows that. Chewing tobacco is probably one of the worst things you could do. Chewing tobacco will cause this to happen real quick. The gums start receding away from the teeth because the tobacco just sits there and basically causes that to happen. Chewing tobacco is probably the leading cause to oral cancer. And if anybody has seen oral cancer, it is gruesome. It's gruesome what ends up happening. And it's just not something you want. So if you know anybody that chews, tell them to stop. My son, went away to college. I'm a marathon runner. Smoking does not happen around me. Smoking, chewing, none of this stuff. My son went away to college, came back freshman year, first trip back, and I find a can of chew. And let me tell you what, that was not a good day.
There are doctors who do oral cancer screenings when you just go to the dentist. So I know we can do them at our clinics. If you see somebody else, just ask them, because it's good to at least get it checked on every now and then. But a lot of people don't know that they exist, so just ask them about it.
You may be getting an oral cancer screening and not even know it. Usually when you go to the dentist, they'll do an oral cancer screening. They usually ask you to open your mouth and move your tongue this way, move your tongue that way. They're kind of checking for things. You definitely want to make sure that happens. And they usually do it on a cleaning visit. But if they're not doing that, I would definitely ask for that. Sorry. One of the other connections that we have is bacteria that exists in the mouth. So one of the things we wanted to talk about was the idea that what is the connection between the mouth to the rest of your body? Well, in recent years, there's been lots of really good research about the type of bacteria that is released in your mouth just naturally, and what effect that has on other organs in your body. So one of the things that we know is that bacteria that is released in your mouth actually travels through your bloodstream and will travel through all of your organs. Key organs being your heart and your liver. So we have been able to establish both medically and from a dental perspective that there is a definite correlation between the bacteria in somebody's mouth and coronary disease. So this is one of the reasons why getting regular cleanings, especially if you have periodontal disease, because the bacteria is much greater and it's much stronger, that there is a definite link to coronary disease. So you want to make sure that you're taking care of your mouth. Lots of times when you talk to medical doctors, which I've had parts of my career where I was in the medical side of it, medical doctors for many, many years didn't even look at the mouth. Those were they don't learn about, believe it or not, they don't learn about it in medical school. That's very foreign to most MDs. On the dental side, it's a little bit different because the dentists are trained to kind of know what these links are. So this is a big link that people are aware of today that you definitely want to be aware of because it can really affect your overall health.
And I know we're running a couple minutes long too, but in the last slide, I don't know if you guys could read in the back, it said that this is just one example. Boston, you did a test. Just flossing your teeth every day could either add or take away a year from your life. To me, that was amazing. You put in 2 minutes and you can save a year. I thought that was amazing, but it definitely shows that there's a one-to-one correlation. So that once everything starts to sweep in your bloodstream, and we'll go into it. There's a couple different examples that you'll see how it affects it. But just something as simple as running a string through your teeth can save you all that time.
So this is the coronary disease. So basically what happens is the bacteria is released, it gets into your bloodstream. Your bloodstream, obviously, everything goes through your heart and your liver. And that is why there's such a strong link between what's happening in your mouth with the bacteria in your mouth and types of bacteria that exist only in your mouth and heart disease. So, same thing with your liver. These types of bacteria, everything travels through your liver, is supposed to be clean, and that can lead to, if you have really strong bacteria, like especially with periodontal disease, that can lead to problems with your liver as well. And it leads to liver problems actually that you can evidence by actually in healthy people. So you end up with what they call the fatty liver. You can end up with cirrhosis of the liver, and that's all just because of this bacteria. So again, much more heavily linked to people with periodontal disease, which is why you don't want that to go unchecked. Expectant mothers, any of the ladies here that have had a child, probably the OBGYN has talked to you about gestational periodontal disease. That's kind of prevalent in a lot of women, where your gums will get puffy and they'll tend to bleed. That's usually comes and goes with the pregnancy, but you just want to make sure that it's being taken care of because, again, the bacteria that's released can do damage to both the mother and the fetus. So, ta-da!
That's it.
We're done. All right. Thank you. Does anybody have any questions? I know we took too much time. Good.
I heard that in Lake County they have a free dental clinic, and these are doctors that donate their time, actual dental doctors that donate their time, and it's on a donation basis.
Yep.
Are you aware of that?
Mm-hmm.
And
we'll be in it.
You'll be in it.
Yep, that's the RAM clinic.
RAM?
Yeah, RAM. What is it?
That might be a different one.
No,
That's
that's,
yeah, the brand project is going to be here next year.
Yeah, the
Okay.
RAM is here.
Oh, this is in Lake. Okay.
Yeah, Lake County. Yeah.
Are they doing one in Lake?
My sister's been to it.
Okay.
Yeah.
Well, we're definitely doing the RAM clinic, though.
Yeah, we're doing the RAM clinic here in Ashtabula. I believe that's the first weekend in April.
Yes.
Yeah.
The old Dillard's.
Yeah.
Yeah.
The old Dillard's store.
Yeah. What else do you want to do at Dillard's? My wife used to be a buyer for Dillard's, so yeah.
did you guys hear, my kids were telling me about the connection between periodontal disease and Alzheimer's. Has anybody heard that? I mean, it just came out recently.
You should have done a presentation.
I
There you
didn't,
go.
I didn't know about that one.
because I was telling my kids that my mom's starting to have some signs of dementia, and my daughter says, have her teeth checked. What? She says, yeah,
You know-
so I haven't Googled it or anything, but Alzheimer's disease. And
That's not surprising, but they're finding a lot of links to different diseases, but especially with Alzheimer's for some reason, there's a lot of there's a lot of things about that. Some people will say, I don't know, I'm not familiar with that research, so I'm not sure.
And we have a lot of meth use in this area, and I don't know if you've seen a lot of that affecting people's teeth. because
Oh,
it's-
yeah.
It's so bad.
It's
I mean,
horrible.
It's real, I've seen it.
Yeah, it's really destructive.
Especially initially, so we had opened up shop in November, and it seemed like November we had very, very severe cases, people who had been waiting for quite a while to get in. And I have to tell you that November and a little bit into December were a lot of extractions. Teeth that were just, rotten all the way to the root. and they had to come out because people were in a lot of pain. Specifically, we had a lot of our doctors tell us that you could tell that it was what they call meth mouth.
Yeah.
Because the teeth were all destroyed.
It was what mouth?
Mouth.
Meth
Oh,
mouth.
no, basically, your teeth just rot right out of your head. It's just, really painful and rampant. It happens very quickly.